Hi, my name is Dr. Daniel Fox, and I'm a licensed psychologist in the state of Texas. And today I wanted to talk about personality disorders with veterans that have PTSD and depressive disorder. Before I get into that, I want to say thank you for all of those individuals that have served in the military and that are serving and that provide all of us in this country with all of the liberty and luxuries and freedoms that we have. So I want to say thank you very much for that. What we're going to talk about today is we're going to talk about those individuals that have personality disorders as well as PTSD and depressive disorders, but also about how to go through the course of treatment, how perhaps you can help yourself if you're one of those individuals that meet any of these criteria, and if you're a mental health provider, maybe help you defining some steps if this is a population that you treat. So let's get started. The first thing I want to talk about is a research study from 2004, and it may seem like it's a little dated, but I think that the information is highly relevant. And what they found in their sample of individuals with personality disorders that are also veterans that have PTSD and depressive disorder, they found that 45.2% had one or more personality disorders. And of those personality disorders, paranoid personality disorder was found 17.4% of the time. And obsessive compulsive personality disorder was found 16.5% of the time. Avoidant personality disorder was found 12.2% of the time, and borderline personality disorder was found 8.7% of the time. And then they also found that 16.5% had two or more personality disorders. The research study is going to be cited in the comments if you're interested in looking that up as well. So let's talk about, now that we sort of know what this study found, what about treating those individuals and what do those personality disorders really mean? So the first thing you have to do if you're working with someone that has a substance abuse issue is you have to treat the substance abuse. You can't treat any of the core or underlying content unless you can get that substance abuse out of the way. So that has to be first and foremost, whether these are individuals that are veterans or not. So we have to first start there. When we talk about veterans and substance use disorders, we find that more than 2 out of 10 veterans with PTSD also have a substance use disorder. And war veterans with PTSD and alcohol problems tend to be binge drinkers. And the binges may be in response to PTSD issues such as bad memories or combat trauma. Also, 1 out of every 3 veterans seeking treatment for substance use disorder has PTSD. So it's important to be aware and making sure that we're looking for that content, whether this individual does meet criteria for PTSD, and make sure that we recognize that in our treatment protocols and approach. And if you have that, about seeking treatment, whether it's at your Veterans Administration or through another mental health provider. So, and then for those that came back from the wars in Iraq and Afghanistan, about 1 in 10 returning individuals that they see in the Veterans Administration have a problem with alcohol or other drugs. So we know that substance abuse is a pretty serious issue and that it's something we need to get under control first before we can really rein in those PTSD and depressive symptoms, and certainly before we get to any personality disorder issues. And if you remember in the beginning that I kind of gave you some statistics about some particular personality disorders that we're likely to see in veterans that have PTSD as well as depressive disorders. So let's talk about those for a moment. Paranoid personality disorder was one of those. And what paranoid personality disorder is, it's essentially this distrust and suspiciousness of others and their motives. So you don't know who to trust, you're very questioning. A lot of times though, if it's a personality disorder issue, I think that you will see sort of these roots before this individual joined the military, before they had any combat trauma. So we want to be sure that we're getting a good history, that these issues were there before the trauma, that they're not just associated with PTSD. So we want to be able to discern those two issues. Another personality disorder that was mentioned is obsessive compulsive personality disorder. And this is sort of that preoccupation with orderliness and perfectionism. And again, we can see this in those who have PTSD. So we want to be sure that we are teasing out, is there that sense of orderliness, perfectionism prior to joining the military, prior to any combat trauma? And that's certainly going to be important. We also want to rule out avoidant personality disorder. Now, avoidant personality personality disorder is sort of this social inhibition, this intense feeling of anxiety, hypersensitivity to criticism, highly reactive. And if you've noticed, as we've gone through a lot of these personality disorders, these three, paranoid, obsessive compulsive, and avoidant personality disorders, they really, you can see how they fit into PTSD, but they could be missed. If we're treating an individual who has PTSD and we're seeing these symptoms, but maybe treatment isn't working, group treatment isn't working, that a lot of these behaviors and symptoms that are more associated with the personality aspect as opposed to the PTSD aspect, we need to get a better history. We need to go back and see if these avoidant, paranoid, obsessive compulsive issues were there prior to the military. Or once, you can't diagnose an individual with a personality disorder until they are 18 years of age or older. So that can be tricky because some people join the military at 18 and they stay in for a period of time. So what then we would need to do is discern between combat trauma and the start of that PTSD and those PTSD symptoms and those paranoid, obsessive, compulsive, and avoidant personality characteristics. Lastly, one of the other personality disorders that was noted in the study was borderline personality disorder. And this is a personality disorder where you see a lot of difficulty in interpersonal relationships, self-image, affective reactions, marked impulsivity. Again, these components fit right into PTSD. So a question you're probably asking is, well, which is it? Is it the chicken or the egg? Is it the personality or the PTSD? And what we find in clinical domains is that sometimes people that have these personality disorder characteristics, that they are prone to aspects of PTSD. And when we start to treat that post-traumatic stress, we find that they're not remitting as those who don't have the personality components. Let me explain a little further. What I mean by that is that people who don't have the personality components will have quicker or better success rates with PTSD-directed treatment as opposed to those with personality disorders. Because those personality disorders tend to be entrenched, they're how we see the world, how we function in the world, and they hinder us from adjusting our behavior based upon the situations that we're in and the emotions that we're feeling. So it's important to be aware of that, to be aware of all these factors. And when we talk about substance abuse, we go back to what we were discussing earlier. That issue of substance abuse is so critical to address first because it can really confound and confuse the treatment process. If you are an individual who some of these descriptions fit for you, it's important to find a therapist who knows how to work with individuals with personality disorders and PTSD. So in your local VA, I've had a number of students that have gone on to work in different veterans administrations around the US, and they are skilled in working with personality disorders as well as PTSD. So sometimes at intake at the Veterans Administration, you could ask if someone has a specialty in personality disorders and see if maybe you could be directed to them in order to get the treatment that you need. First and foremost is substance abuse treatment. Then we want to deal with some of those mood disorders and try to remit those as best we can, and then deal with those personality disorder issues. The thing is, it would be nice if the world was nice and linear, but it's not. So sometimes we have to plan for that treatment, and sometimes we have to approach treatment recognizing that we're going to go down different paths at different times based upon what issues come up. So we want to be sure that we're fluid and adjust for what our clients need, for what these individuals need. And perhaps if you're watching this and you fit this category, what you need. And recognizing that it's not always going to be an easy, straight step to disorder to wellness, and that there may be issues where you take steps back and you take steps forward. So it's going to be important to work through this process as best you can. I hope that you've enjoyed this video, and please leave any comments or suggestions that you may have. And thank you very much for your time. I appreciate it. Bye-bye.